On behalf of myself and the entire ARMC Emergency Medicine Residency Program, I would like to thank you for taking the time to interview with us today. I'm Maria. I'm one of the current EM residents at ARMC, and it would be my pleasure to take you on a virtual tour of our residency. Let's start off with the hospital itself. Arrowhead Regional Medical Center is located in Colton, California, serving the entire San Bernardino County, which is the largest county in the entire United States. We are a level 1 trauma center, meaning we see some of the worst of the worst. We're also a regional burn center, as well as a comprehensive stroke center. We are currently in the midst of becoming a semi-center. We have on-site behavioral health units, including our new child and adolescent behavioral unit, and we host over 40 different subspecialty clinics. We are a 456-bed hospital with a 50-bed emergency department, but our waiting room is limitless. We see everyone that walks in through our doors. Our patient census is over 100,000 patients per year. Our nursing staff are well-trained and well-equipped to assist us in every type of emergency we run into. And we have a wonderful and highly capable faculty group overseeing our residents as we tackle this large patient census. Let's meet some of them now. Overseeing the entire emergency department is Dr. Borger, our medical director and chairman of the department. He has a wealth of knowledge to share with us, not only about medicine, but also the inner workings of the department, how to maximize flow of production and patient advocacy. Dr. Zhang is our program director and brings a charismatic energy to the residency program. He's one of the most approachable human beings I've ever met and truly cares about our learning and development as residents. Dr. Archambault and Dr. Fanati are assistant program directors. Dr. Archambault is involved in local EMS and SWAT teams and always challenges us to think critically about our medical decisions while pushing us to be independent. Dr. Fanati is well-versed in wilderness medicine, taking us on exciting trips to hone our skills. As an avid surfer who has been through some of the worst injuries, he has plenty of knowledge to share with us. Dr. Lee not only is part of our core faculty and previous program director, but is the DIO, or Designated Institutional Official, overseeing all of the ACGME residency programs at ARMC. She always has our backs and is ready to support us in our growth to become a future attending. Dr. Sai is our regional director, a man on the move. He always seems to have a smile on his face despite his crazy schedule. We have a goldmine of knowledge and experience in the rest of our faculty as well. Dr. Tran is highly invested in global medicine, making frequent medical missions to South and Central America and Africa. Dr. Niki, Dr. Pennington, and Dr. Meeker are all involved in our EMS services along with Dr. Archambault. Dr. Mistry, Dr. Johnson, Dr. Chinwani, and Dr. Gastelum are all ultrasound fellowship trained and boarded. Dr. Mistry and Dr. Johnson are also board certified in critical care. Our finance guru is Dr. Yuen, and Dr. Crouch is our director of simulation, 3D printing guru, and assists us with all of our sim lab needs. Dr. Lux, Dr. Sin, Dr. Kinney, Dr. Manil, Dr. Pilar, and Dr. Kemp are some of our most caring mentors that we have, all practicing at different sites but frequently work with us for the love of teaching and help us broaden our perspective of different ways to practice emergency medicine. Now for some insight about the residency itself. Our emergency medicine residency is a 3-year program. Our ED shifts are 10 to 12 hours depending on the shift, typically from 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. As an intern, the focus is on you. You will always be paired with a senior for your shift, who you can lean on for advice on how to properly manage any patient that walks in. Your attending will typically manage multiple pods, but is always available when you need them. During the shift, you will run into a huge variety of pathology given the high volume of the hospital and the diversity of San Bernardino County. Given San Bernardino County is so large, with much of the population being impoverished, with little access to proper health care, you will learn to treat pathology that you might only otherwise see in TV shows. You may also, on any given day, run into a mass casualty event. Being a level 1 trauma center and burn center, we are the best option for most traumas that occur in the area. Our trauma experience is longitudinal, meaning that when you are on an EM month block, a third of your shifts include trauma. Traumas are classified by severity into alerts and activations, with activations being more life-threatening. The trauma surgery team assists with all weekday activations and alerts, but on weekends, they only assist with activations, so it's the ED's job to hold down the fort. The EM senior is always at the head of the bed and manages the airway during traumas, and the interns will handle primary survey, secondary survey, and procedures, including EFAST, lines, chest tubes, etc. Our medical pods are broken down by pods A, B, C, D, and R, depending on severity. Pod A is our trauma bay. Pods B and C are the highest severity, where as an intern, you'll find yourself doing intubations, central lines, lumbar punctures, and much, much more. Pod D is a mid-severity pod, where we also care for our incarcerated and psych patients. Pod R is essentially our triage area. The lowest severity patients will be seen here, and you'll learn how to manage a high volume of patients. As for our didactics, we have lectures once a week, every Wednesday from 7 a.m. to 12 p.m. This includes a weekly multidisciplinary trauma conference where EM, trauma surgery, neurosurgery, anesthesia, and orthopedics all come together to learn how to better care for our trauma patients. As a resident, you'll rotate through a variety of other specialties, including general surgery, internal medicine, medical ICU, CCU, surgical ICU, pediatric ICU, peds EM, anesthesia, orthopedics, and OBGYN. We also rotate in emergency departments at outside community hospitals, specifically at St. Bernardine's and Pomona Valley, and our new rural emergency medicine elective at Bear Valley in Big Bear. Dr. Henson and Dr. Laba are our main points of contact at St. Bees, and Dr. Moore and Dr. Koo are our contacts at Pomona Valley. Dr. Menil is our main contact at our Bear Valley site. The other residency programs in the hospital are IM, FM, general surgery, neurology, radiology, OBGYN, psychiatry, anesthesia, neurosurgery, and our new EMIM program. You'll frequently run into other residents, and they'll quickly become your close friends as you rotate through each other's specialties. The transition into residency can be intimidating, and we're all human. The stress of residency can sometimes weigh you down. The beauty of our 12-hour shifts is that we have less shifts a month, which our residents use to enjoy their personal lives outside of work. We hang out a lot outside of work, and some of our socials have included going to the Dodgers game, barbecues, poker nights, celebrating birthdays together, holidays together, going to trivia nights, having our own hot pot nights, and many more. We have surfers, snowboarders, dirt bikers, DJs, rock climbers, bakers, gardeners, and many more hobbies that our residents participate in. On top of this, we host an annual retreat every May, which our new interns are always invited to and encouraged to attend. Overall, we're a tight-knit program, and we all support one another through the challenging journey of residency. The support and camaraderie that I've developed with my co-residents and mentors has personally made this transition into residency so seamless, and I would choose Arrowhead 1,000 times over if I had to do it again. I have no doubt in my mind that all of my colleagues will excel in any system that they are placed in after residency, simply by the level of training we obtain at our program. So as you proceed to decide which program to attend, ask yourself, what kind of training would best prepare you for a life as an emergency medicine doctor? If the answer to that is a fast-paced, high-intensity, fun, and supportive environment, then ARMC Emergency Medicine is the choice for you. On behalf of myself and the program, thank you so much for joining us today, and we hope to see you again.